I think this is a very important question because about the caregivers, we often do not focus much. We are all focused on what to do for the patient, what to do for his illness, how to get him better, but the caregiving aspects are often neglected. Especially in India, where the family is a very important cog in the wheel of care, the caregiver must ensure that the medications are being taken properly. Many a times, people with schizophrenia or bipolar disorders lack insight into their condition. They feel these medicines are not required. Especially for a bipolar patient who is having manic symptoms, no, these medications are putting me down. I am so energetic and I feel so good. Why should I take medications? For a schizophrenia patient, on the other hand, there is total lack of insight. Often, they don't recognize that they have an illness. They don't recognize that it can be treated. So, from that point of view, the caregiver has a lot of responsibility to ensure that medications are being taken on time. Secondly, often crisis happens. Like, say, for example, an episode of aggression at home. For a schizophrenic patient or a bipolar patient, they might indulge in some episodes of unexplained aggression. So caregivers are often confused how to react to that, and they often feel that the patient is doing it deliberately. In such cases, the caregiver must not escalate the situation. When the patient is feeling very upset, the best strategy is to just leave him alone for some time, rather than trying to argue with the patient or trying to scare the patient by showing physical objects which can be used. That only escalates the situation and brings it to a point of confrontation. So do not confront a violent patient or an aggressive patient or a very disturbed patient. Just leave him alone. After some time, he will come out of that mood or that episode, and then he'll be in a better position to communicate to you. At that time, discuss with the patient what was it actually that led to the aggression. And then you'll be surprised that many caregivers have said that there are certain common things that upset a patient, like, say, for example, some negative comments by some family member, some overcrowding that happened, or the sight of some dangerous weapon provoked some bad thoughts in the patient. And so these kind of things, if we discuss with the patient, we can, over a period of time, we get to know what provokes a patient, and the caregiver can learn to avoid that. I think the third and most important thing for a caregiver, what we talk about in psychiatry, is called expressed emotions. And expressed emotions are known to be a very common factor or a very much evidence-based factor in the relapse of conditions. So we often, as psychiatrists, we often tell the caregiver to reduce hostility towards the patients. Do not make hostile remarks about the patient. Do not become over involved with the patient. Often caregivers have a very protectionist tendency. Okay, this is my brother or this is my sister who is suffering from psychiatric illness. Let me do everything for him. Let me give the brush in his hands. Let me give soap into his hands. That's not required. Over involvement only increases the dependency of the patient. The patient has certain areas of his personality and life which are still preserved in spite of illness. He can still continue to take care of himself. So let him continue to do that. Do not get over involved with the patient. Give him or her his personal space and freedom. But at the same time, be around to extend help if required. Ensure that medications are being taken on time, and do not unnecessarily get into any confrontation or make hostile remarks about the patient. I think if these steps, simple steps, are followed, it can go a long way to improving the caregiving aspect for a chronic psychiatric patient.